You did hear that I had the interest in training in OBGYN, so although there's no medical advice if anyone goes into labor, and I'll be happy to help deliver the baby, I still hold the record in Cleveland for emergency deliveries. Doctors never are the ones that do the most of that. It's always the paramedics, because they get called to a house. But from the ER on up to the upstairs in the hospital, I still have the record for that, because I never used to send the people in labor straight upstairs in an elevator with an orderly or something like that. So it never made sense to me, so I did the deliveries myself. Haven't done one in a while, but I think I'd remember. It's like riding a bike, Unless you men think that wouldn't apply to you, have you seen the tabloids lately? Men can deliver babies too, so they can have a pregnancy and everything, So that's anecdotal, not scientific. So I'll help you deliver your kid too. All right, so doctors only do two things. We do diagnosis and treatment, really. Some of us do research and teaching and things of that nature as well. So we'll talk about those, and just keep that framework in mind about what a doctor can do, really. But the first thing they do is listen to the symptoms a patient had. I had the privilege of talking on the ride here with Dr. Who. She's in the room right here. Raise your hand, Valerie. She's right there. Could have been the other hand. I wouldn't have minded. And she has done some terrific things with the research for the biochemistry and the genetics of autism and other disorders. She has a new book, by the way, and she will sign the book. I'm committing you to that already. That's at the Horizons bookstore there, the New Horizons. It's the black book on the corner right when you walk in the room. And it's very thorough and scientific. But the first thing she said, I'm paraphrasing her, is that you have to be pragmatic and listen to people about the symptoms, the so-called phenotype, right? The overt, outward, observable symptoms somebody has. And then you can put things into categories and make sense. We have about 200 treatments we can do for autism spectrum issues, ADHD, OCD, and these related disorders. But we don't do all of them in every kid, and we don't just take every kid or adult. We have some of the oldest people in the country and in the world with spectrum issues. Our oldest one is in his 70s now. The youngest ones are in the uterus. I'll talk about that too. And we always have to go by symptoms and by risk categories and what the patient tells us. So it starts with you or your child or your loved one, if you're an affected person or you have someone that's in your family, and what symptoms or what concerns that you have. Sometimes we have a person who's having a normal pregnancy and they want to prevent having a child who is afflicted with autism, like their niece or their nephew or something like that. So these are always issues. Okay, and what is autism? It gets to be abstract, doesn't it? Like, well, you know what it is. It's just, those of us who live through it and see our children live through it and see our brothers and sisters or our spouses live through it, or who take care of children in a classroom or in an institution. Some children and adults do live in that setting, obviously. We know what it is. You can see it across the room sometimes. Obviously, the severe cases of someone who's flapping and maybe doing self-injury and has, they're 8 years old and not toileted, and those are more obvious cases. Then, some of the more mild cases require specific categorization and so on. Well, Leo Kanner in 1938, and look up his picture on the internet. People sometimes pull up their cell phones right now and look. He was kind of his own unusual-looking guy, and he was a very pensive guy. He was a pediatric psychiatrist at Johns Hopkins. The children's hospital there is called Harriet Lane, and he started getting referrals from all over the country in the mid-30s. All over the country in the mid-30s, and pediatric psychiatrists and psychologists were very rare birds in those days. So he was getting these from everywhere. And he saw a pattern, kind of like I talked about with Dr. Who, a pattern of things, and he called it autistic disturbances of affective contact, your emotional connections with things. And that's one of the people where the word autism came from, and he was the one who really used it first. And he saw this way that the children were. And he also made some comments about the parents, too. He said the examiner will resist assuming that the parents' unusual characteristics and traits are somehow etiologic, meaning he said right then and right there, don't blame the parents for having a weird kid. He said it right then. The very first. A lot of people, not necessarily anybody in this room, need to remember that. So it was an overt symptom definition in the beginning. Overt symptoms, okay? The outward psychological, behavioral things and the developmental delays. He also mentioned in there, though, a lot of biologic things. Several of the kids had chronic strep and other types of sore throats. Several of the kids vomited every single solitary time they ate. One of them had a feeding tube. It's the only way they could get nutrition, surgical feeding tube placed. My son did as well, same thing. My wife will be here tonight, but many of you have met her, but she's also going to be speaking through the weekend and panels and so on. And she'll tell you that story. It broke her heart very much as mine, and I know you all realize that with all of our kids and adults. But then he turned right around, and I'm not criticizing Dr. Cantor, but the second bullet from the bottom, he completely dismissed the biology. So he was doing what thorough physicians were trained to do, and hopefully we still are, but in those days you would train, and write down everything about the patient, present it all, and then focus on what you thought was important to present this to people who you wanted to communicate the issues about a group of patients. And he completely went on and just didn't say a thing about all these biologic findings that were there. Physical issues, illness, okay, infections, all right? Some of them had growth issues, and growth has a great connection with hormones. So the bottom line is the biology was there from the start, and so if we look at a clearer definition, then we look at what the underlying cause is. Now, we always have to remember the pragmatics, like I mentioned in the beginning, and there are other talks. Again, Dr. Who's going to give a talk about this, so you can see, her talk. She'll go into more detail about some of these issues. But you always have to look at the pragmatics of it. But when a person is defined and identified as having severe Asperger's or OCD or autism, okay, then you got to say to yourself, what's the underlying cause? It's the same thing that happens with somebody who has a stroke. They get numbness in their face and they can't use their left arm and they speak, maybe garbled, okay? That is a right hemispheric stroke in the right side of the brain till proven otherwise. Okay, the left brain formulates the words, but the right brain can have things to do with how your jaw and your throat and your tongue work, right? So you can have garbled speech, but you try to make a normal sentence. These are the things doctors will think about right away, okay? And people know that when that happens, I'm diabetic and I have high blood pressure and I'm 47 years old and my blood sugar's okay, something's wrong, and they tell their spouse and they go to the hospital because they think of it as a medical problem. And that's the way I'm asking you to think about spectrum issues. The severe case of the kid sitting in the corner, rocking with her back to you, biting her fingers, okay, who's got a diagnosis of autism. GI problems, okay, immune system. These are the parts of your body that support your brain, really, okay, and they do all kinds of other wonderful things for your body. But when you're sick with these areas, the immune system, metabolism, what's metabolism? What we take in our bodies, food, water, air, okay, toxins, and what we do with it, how it gets changed and turned into things. How does a chicken strip get turned into an eyelash? That's metabolism, really, when you get down to it, okay? Or a thought, or moving your arm, that's metabolism, all right? And all of these are affected in the spectrum issues, and you often find them abnormal, even in a person who doesn't have any physical symptoms. A lot of times, one of the first things we ask is about the GI tract. And the parents will say, well, the bowel movements are normal, so my child must not have any. Sometimes we look, there's tremendous issues with yeast. Dr. Shaw, who discovered ways to find yeast by looking at the urine, is going to be speaking later, and that's a great talk to go to. You can ask him the story of the two twin boys with autism, and he was analyzing their urine, and he thought, geez, these are things you see in a yeast culture. What is this all about? And he used that to discover that's the way to detect yeast present in the GI tract. And so that really was, kind of a breakthrough. So these are physical things, okay? All right, and the cerebellum I have in there, for example, in the middle of that weighty paragraph there, that's the kid that walks unbalanced, kind of wide gait, that kind of thing, okay? And that's not weird parenting. That's a medical problem. It's not mental, okay? And those of you medical people in the room, the cranial nerves and all these issues are affected. So let's talk about what further clarification of the definition. All the A's and all the D's I've been saying for years, okay? There's many more of them. You know, there's autism and PDD and ADHD and OCD, and RAD is in the adoptive kids, right? And I always say 3-letter abbreviations and these phrases like that in medicine. There's always some other phrase. RAD also refers to asthma, reactive airway disease. So this, I'm talking about the term psychologists use for adoptive children, reactive attachment disorder. They have very similar biology when you look at their testing and compare to the children with spectrum issues. And a lot of our kids cannot connect because of the autism and the issues that go on with relating and the quote-unquote autistic disturbances that Kanner talked about way back when. It's an excellent paper. You'll see some of your own kids or yourself in that if you go back to that paper. It was published in 1943 in the more famous version. And if you go to the old medical libraries and blow the dust off of them and look at the books, the next article is written by a guy named Hans Asperger. And he described Asperger's syndrome. And Hans Asperger was this stout, sterile-looking, long white coat with a long stick, and he would point to the patient with this long stick like he didn't want to touch them. And he has this teenager who has Asperger's standing in his underwear there. In those days, there was a little bit less, I think, compassion for the way they put photographs up, and I have parents' permission for the photographs we have here. And he showed this child with poor tone and very sickly, malnourished, and he talked about the Asperger syndrome. But he didn't call it that, but other people named it after him. So it's very interesting to pull that up, and you see that whole... It's fascinating that in those days they didn't think of them as the same thing. They're right next to each other. It's fascinating. And they use some of the same terms. So when you look at OCD and senile dementias of the Alzheimer's type, that sort of weighty paragraph in the bottom, some schizophrenic-like and bipolar symptoms. A lot of the parents have been diagnosed with bipolar. Sometimes it's not bipolar, and just because other people don't like them, they say, oh, that's bipolar, you know. And not because that always happens, but it does. And I'm not shy to say I think there's a lot of prejudice against the kids and adults afflicted with these issues. You heard about that next door just now, and the parents as well. So, yeah, I was talking about some of these rulings on the First Amendment rights. And for God's sakes, if we can let people burn crosses on people's lawns and all this because of their First Amendment rights, at least we can let people express themselves a little bit without criticism, but that's just me. Dyslexia as well, though, these nonverbal learning disorders and many of the mental retardation syndromes, really, when you look at the biology, it's all what we're going to talk about here. Let's start with the GI tract, which starts at your lips. Lots of kids have trouble swallowing and chewing. I just talked to a parent who says the kid is now an adult, and they're getting more severe and having trouble, and they always did, never really chewed up their food. My son's had that issue. It's not only pieces of balloons and foam toys that we find in the stool, you know, over the years, but sometimes things like, he'll ask for a bunch of grapes, and sometimes those come out in the stool. And he's much better. He doesn't have his feeding tube anymore. And we always used it for the supplements and the oils and things that he had a hard time swallowing because he could never do liquids. Swallowing dysfunction is a really challenging difficulty. With my own son, again, I've always said he'll swallow, cyanide and radioactive material if you put it in a capsule. But he can't swallow liquids, except water. It's the only one he likes. He'll do that, and he can't take liquid medicine. He's never been able to do it. And I was the best doctor in the whole world, so when he had his multiple ear infections, I'd give him shots of Rocephin, and all these other things. But he still had his issues with swallowing and so on and so forth. A lot of kids have these extremes of taste sensitivities. They either don't have a lot of issues where they can taste things, or they seek out stuff you'd never think a 2-year-old would want. Garlic, salt, pepper, Tabasco sauce, these kinds of things. And they'll chew on things, and put things in their mouth that are really almost sharp and so on and so forth, because razor blades, if you leave the razor in the shower and things like, they want to feel something beyond what they can. They have that sensory starved, right, the sensory integration issue. Then there's other kids that they're either all crackers and dry, hard things, because they're not going to let something runny that's going to drip down their throat, right? So those are the kids that somehow, just can't handle something. They feel like they're drowning if you give them a liquid. And they drool all day. And then when they're ready, they think really hard, and they gulp, and they choke and cough, but they gulp because they're thirsty, and that's what happens. And they stuff their mouth because they'll eat the whole meal, but they'll walk around and their mouth gets filled up. You know, I hear people already, they know what this is like. And they'll do one swallow for every would-be 5. And they know what they're doing. They get scared and they feel like they're going to choke every time they swallow. And they're hungry just like their brother is. So they'll fill their mouth up and they stuff and they look like a gopher, you know, and then they swallow it. And then there's the kid that you turn for a second, the hot dog is there, you turn for a second and it's gone. In 2 bites, sometimes 1, you know, and they swallow it all the way whole. And that's where you talk to people like Devin Houston about enzymes and things like that. And a lot of kids will reflux, you know, they cry and when they go to sleep because they get the acid coming up. And they start to cry because they either choke and wake up or they burn. And then you pick them up, and we used to carry my son around and when he was a baby, and he got to be more, and then he'd fall asleep on your shoulder and you'd get him back to sleep and lay him down, and 5 minutes later he was awake. And then almost always there's something abnormal growing in their GI tract. Yeast makes alcohol. That's, you know, we talk about yeast toxins. The most famous yeast toxin is available at any liquor store, okay? And that gives you a hangover and heartburn and nausea and things like that. Well, all the yeast toxins that Dr. Shaw described and discovered can do that. And so that's the issue that, you know, a lot of the kids have the reflux from. And there's tremendous inflammation. I was talking with one of the parents. They talked about mucus in the child, and this is the same kid, one of the other family members, the adult that's chewing things a little bit and swallowing. They're seeing all kinds of mucus and things they haven't seen in years in the stool. It looks like snotty, I mean, if I can just say it that way. And that's what you see. It's just totally abnormal. And this business of, at the bottom here, constipation, one of the gastroenterologists that is in one of our towns that I have the practice goes around telling parents, and I just, at the very least, you can tell I respectfully disagree, says it's normal to go anywhere from 7 bowel movements a day, or the next kid can have 1 bowel movement every 7 days. That's normal. Well, I'm going to paraphrase that and say, if your kid's not going to die, I don't care. You know, that's not normal. What if he didn't have bowel movement for 7 days? He'd be running around, you know, wanting to find the solution to it. Okay. So, you know, it's just not normal. And a lot of these endoscopic, you know, and I realize people like Dr. Wakefield and all that have been controversial, but he found something a lot of people find when they scope the GI tract of children with autism. It looks like strep throat with the bumpy red and white patches, lymphonodular hyperplasia, totally abnormal. And I've seen some of our colleagues in gastroenterology call that normal if it's an autistic kid. That's normal for autism. They'll say that. And then the next kid that has it, they're running around trying to treat that. It's not normal. It's abnormal. This is abnormal. Again, with the mother and father's permission, this young man, you can call this distension. You can call it an inability to defecate out the stools that are forming. That causes pain and just a lousy feeling. When you don't defecate your bowel movements, you feel lousy. There is not only a formed substantive mass of stool that we all try to defecate out every day, but there's toxic material, and it's not that that's bad that it forms. It's supposed to form and be moved out, and you feel lousy, you feel out of sorts, and it causes pain. But it's anything but abnormal. I mean, it's abnormal, and it's not normal, in other words. And this is not bad parenting. This is somebody who can't defecate their bowel movement. Mitochondrial problems can cause that. What's that? That's the machinery that moves your tubular muscular passage through that doesn't have the right energy and mechanisms to work right, and you get backed up like that. So the GI tract is paramount in our kids. What about the immune system? This is a busy slide, but only 3 things happen when your immune system is messed up. Either can't shoot at the enemy, that's the first one there. Frequent infections, colds all the time. Again, some of our colleagues in the children's healthcare world have said it's normal to have a cold, last 2 weeks. You never really get over it till 2 weeks. Then you may go a week or 2 without one and get another one. It's normal for the average 3-year-old to have that. I couldn't disagree more. I couldn't disagree more. We have a family of 3 children and both parents that we treat. And all of them have issues, and we treat them. Everybody's responding to the behavior and mood part of the symptom relief. We're doing biologic treatments, okay, except one kid. And he's very challenging to treat. He's very aggressive and moody, and he's self-injurious and things like that. But he doesn't have the colds that he was having, and doesn't have these almost going to the ER and being admitted several times a year to the hospital for things like pneumonias. and abscesses on the skin and things that just aren't normal for a healthy kid to get. Okay, so these are things, so we're making headway on the immune system with that child. Now we want to do things with brain chemistry, which we thought would follow our treatment. So, that just tells us. But that's infections, okay? And there's a case I read, actually, if you look at Evidence of Harm, that's David Kirby's book. He's an investigative reporter. In the beginning, he goes through all these families he's going to talk about in the book. And one of them is one of the families where at 1 year old, this kid's getting strep infections every 2 months. That's very unusual. Now we see it more frequently. That's an immune system problem. It's just not normal to have that. And the kid's not in school. They're not on a bus with other kids. They're not 7, 8, 9, 10 years old. They're not a teenager, being around other people and kissing people and all this other stuff. That's just not right before the kid's even walking, hardly, to get strep throat. What's the second thing can happen? Allergy. What's that? That's shooting at everything. Your immune system doesn't know what to do, but it shoots at everything. Asthma, stuffy nose, okay, rashes all over the place. Sometimes the GI tract gets affected with that too. And then you treat with steroids like prednisone, and then the yeast grows, and some of these other yeast issues get worse. Then the ears plug up because of allergies. They get ear infections, and then you give antibiotics, and that makes the yeast grow. And it's well-intended things that we do as doctors, but then we see the back end that can make the problem worse in some of our kids and adults. And autoimmunity is very severe, and that's when there's a civil war in the body and you're attacking your own body with all that dynamite the immune system has. And the thyroid is a very frequent target of disaffection with that. Okay? And then these long terms here, group A beta hemolytic strep, the GABs on the bottom, that's strep throat. And there are many other strep germs. I have an example of that here. PANDAS is OCD, the obsessive compulsive disorder, the kid that always has to wear the green shirt with the orange frog on it whenever they go to grandma's house. Why? Because we always do that. We did it the first time I can remember going to grandma's house, and I'm not leaving the house unless we do that. And they kick and scream. The kid that has to take the globe everywhere. The Aspie kid that has the globe, and he knows every part of the world that you never heard of, and every part, and he's got to take the globe with him everywhere. Disneyland, your sister-in-law's wedding, this kind of stuff. You know what I mean? And so that's OCD, okay? And so that's an autoimmunity to the brain, discovered in Cleveland by Dr. Ramelkamp, who was a professor just retiring when I was a med student. And these GI things, this endoscopy business, that you see, these are autoimmune, inflammatory bowel disease, these kinds of things. And the opiate receptors, what's that? That's endorphins, that's pain control, that's the GI tract, that's the immune system. There's endorphin function throughout the body. Those work through the opiate receptors, and when you have autoimmunity shooting at those, that stuff doesn't work right. Discovered by Dr. Aristo Voisdani. It's a hard name to say, Aristo Voisdani in Beverly Hills. You can look him up. Okay, what about toxicity? Because we're going to cover this gamut and talk about what we do with this. Mercury, I think, is not the only basis for kids with spectrum issues. I believe a lot of our kids are pure bona fide mercury poisoning. A lot of it's from vaccines, a lot of it's from other things. There's all these controversies and upsets about discussing this kind of thing, not because anybody in the room is going to be difficult about it, but others have. I don't think every kid with autism has mercury poisoning. I don't think mercury is the cause of every case of autism, okay? But I think a lot of the kids, when you kind of go through what mercury's poisonous to, it's these systems we're talking about. And when you look at what our kids, that's the bottom little bullet I have there. When you look at what our kids and adults with spectrum issues, and a lot of the parents who want to prepare for pregnancies and all this, when you look at what they do with metals, good metals like zinc and copper and thing, and bad ones like lead and aluminum, when you look at their testing, okay, the Great Plains Labs has Dr. Pratt Hyatt here, very tall, thin guy with dark hair. He makes me look short, okay? So he's here, and you can talk to him about, he's a toxic, basically he does a lot of things in toxicology. You can speak to him. Are you in the room, doctor? There he is, right there. See, even sitting down, he's taller than I am. All right, so you can talk to him about what analyses can be done. And that lab receives a lot of specimens from us and from other places. And the kids just do abnormal things with their metals. And they hold on to bad ones and get rid of good ones. And that's not good for their nutrition. And chelation helps that. I don't chelate everybody. Chelation is where you use a substance to move metals around in the body, and it helps you increase the excretion of toxic metals. And the bottom line is that helps a lot of persons with autism. And it helps their autistic features to get better. They're more comfortable, less pain. A lot of kids will touch things, they'll pick them up like this, like I'm doing. They don't want to use the tips of their fingers. They stuff things in the back of their tongue, and they avoid the tip of their tongue and their lips. And they stick their tongue out, and they lick things with the back of their tongue. And they just do these acrobatic things because it hurts when you touch the front of their tongue and their lips and their nose, the tips of things, so-called acral areas, because mercury poisoning and lead poisoning and things can make those hurt, okay? And neuropathies and autoimmune neuropathies and things like dioxins and PCBs that the Dr. Pratt Hyde analyzes. Much harder to analyze those things, okay? But when you clean up the diet in the home, that's better. Organic food, okay? Clean food, whole food, filtered water. And so, I think all of us are going to accumulate toxins and have our issues later in life. But the kids get hit a lot earlier. And the adults get recurrences. And to keep things clean often is a simple thing you can do. Again, Dr. Hu can speak to this much more than I can, but genetic disorders, I think there's a lot of misinterpretation of this. And there are some very good tests that people can get for affordable prices on the internet about all these things, but the point is, as I mentioned already, that if you just go test everybody's genetics without categorizing what it's going to do for you and what diagnostic information of a game plan it's going to help you do, sometimes it just sends you in the wrong direction to find out what some detail is. Why take your car apart and put it back together to see that if it's working fine, or if it's only this part of the car that doesn't work, that's what you look at. And sometimes this damage can happen after conception. That's another way that parents get blamed. Oh, you have a mutation. And then the parents immediately feel like your child has a mutation. We're freaks. We caused this gene thing and we gave it to our kid. That's not true. Those genes have been around for thousands of generations. And some of those genes are now getting damaged by things like the toxins I talked about. Metabolism, like I say, is all those things we do with vitamins to burn calories and to make complex substances in our body and build skin and bone and all these things. So all of these things, especially that middle section, methylation, people know about respiration, they know about circulation, they know about the heart, pumping and moving blood through and all that. But methylation is another part of your body. You will not survive if you don't have methylation. Methylation is moving around one atom throughout the body of carbon to make it do the right thing in the right place, taking it off and recycling it, and it does several things. In the brain, it's an on and off switch. We need those. In the liver, it's a switch that it's a metabolic control of how you build and do things with toxins, for example. You can detoxify a lot of things when you methylate them, okay? And in the nerves, you do things with neurotransmitters, right? That's the electrical signals for things, right? Okay? All right, so and transsulfuration just means you move sulfur around. It just means it's complicated, and a lot of our kids are sick in those areas. And you don't feel right. You're not as healthy. You don't have the energy. You can't think straight, okay? We've all seen people, I think, or maybe or an animal get confused or turned around, whether it's from a fever or whatever. The basis of all of those things is metabolic, all right? And these issues of mitochondrial dysfunction, okay? Mitochondria, like the word hypochondria. Mitochondria is the complex metabolism, the heavy-duty stuff inside your cell. And there's a lot of complex stuff, but the real heavy-duty stuff is building special molecules like cholesterol. Dr. Shaw is going to talk about that a little bit. And breaking things down and burning calories. When you don't have good mitochondrial function because they're poisoned or they're damaged or a virus is there or you have that issue and it's just caught up with you earlier in life, then you have all kinds of problems with tone, muscle tone, cognitive dysfunction, seizures, backed up stool, and so on and so forth. All right, I know it's a time you came in to sit in the room and try to relax. And people know and think of me as a laid-back guy, but I'm going to put you to work. This is a sibling group, okay? Who's got the autism in this group? Take your estimations. The kid who's kissing, okay, is what one person says. That's and many people have said it's that child because he's trying to bite the other one and grab onto his neck from both sides and all this other stuff, okay? All right. Any other? I'm not saying that's right or wrong. Any other ventures on that? I'm sorry? The baby? Okay. What makes you think about the baby? something from the picture. Some people have said puffy eyes and all that. She does have some allergy issues. That's a good estimation there. And the one that's doing the kissing is a little more pale, okay? Well, I know the family, so it's easier for me. The one that's looking forward is not really looking at the camera. He was looking with that expression. I mean, I'll give you a little more information. I should have said this. But that expression for about 3 minutes, sitting there before the camera came along. His dad does a lot of sports photography and things like that, so he's always got a camera that he can pull out. And the bright light shining in the face of those two boys, but those pupils are gigantic. With the boy that is to your left. And they don't constrict. The one on his right is a little bit bigger, but that's a nuance, okay? That's too much adrenaline. It doesn't get metabolized. We all need adrenaline when we run up the stairs or get excited when you're a kid. And then seconds later, when the excitement is done, your body methylates the adrenaline to destroy it and to make it not make you all wound up and jump around and be hyper and get cramps in your abdomen and have fevers and sweating and things. And he doesn't, well, at that point, he didn't do a good job with that. And the picture with the other boy is the one kissing him, and he's just trying to be affectionate with him and shake him out of it. That's, obviously with the parents' permission and all that. And he's always trying to re-engage his big brother because he always hears the parents talking about that. And they've since had one other child. So the other kids, the oldest one that's got the autism with the big pupils, and the other kids, they've had one more child. They're paramedics, both the parents, and they delivered this baby on the way to the hospital in the car. The wife said, "Pull over, honey, you got a delivery to do." So this gets into a lot of issues that we've talked about, and also prevention. And prevention starts before a pregnancy starts. And again, this is not a guilt trip for mothers. I think that's been overdone. Stories and research came out, and I think it's wonderful. But that when, we're always told don't let the mother be skinny and not gain some weight. And then research came out a year ago, don't gain more than 5 pounds over the range you're supposed to gain during pregnancy. Otherwise, you have a higher risk of autism of your kid. I couldn't disagree more. There are all kinds of things with that 5 pound. They didn't discuss, and you can go back in the USAAA newsletters, they didn't discuss how tall the mother was and what her pre-pregnancy weight was. They didn't gauge that. So if you're 100 pounds, I saw a mother the other day who's 98 pounds. Most of our moms are very small in one way or another, small bones or small body build, or they're short, or one of the, my wife's 4'10.5" when you see her, if you haven't met her. So these are the issues we see. So that, prevention, I'm talking about a clean home, clean diet, and some of the other societies, other than our kind of, I guess, stereotype Western kind of way of doing things, really revere the young couple that has, are going to be having babies and pregnancies, and they're very cautious with everything from, warmth and protection from the elements to proper diet, and the elders in the community and the family in the neighborhood are always coming around making sure the food and everything is done, low stress, and nothing toxic, and these are the issues that we want. So you can go to the New Beginnings desk out there and look at the fish oil that they have. And DHA, right, has come out. We've been using that for years, pre-pregnancy. And in the last few years, it's come out as being put into baby formulas. That's the oil for the brain for the developing fetus. And then a low, no toxic pregnancy is very important. And all these toxins in here that you can talk to the scientist I mentioned, Dr. Pratt Hyatt, about. VOCs, if you're painting and putting a new carpet, do it in the summer. If you have a new home you're moving into, open the windows, let the VOCs, all these chemical volatile substances, go out the window, and steam the carpet. That's what we do at our offices when we replace the carpet, okay? And good minerals. Minerals are very important during pregnancy, and not just iron, zinc, calcium, copper, because if you don't have those good minerals, the toxic minerals like lead and mercury are more toxic because they don't have competition, okay? Postpartum, I do refer to vaccines with that. I think that not everybody can get the same dose of the same vaccine and still get the same effect. Not everybody gets the same dose of amoxicillin. Not everybody gets the same dose of pain medicine. The dose of hepatitis B vaccine when you're 30 minutes old is, there's got to be a nurse or somebody in the room, 0.5 mLs. Okay, what's the dose for Shaquille O'Neal? 0.5 mLs. One of them's wrong, okay? And so we're very cautious about that. And that's not the only thing. and there's aluminum in that vaccine. That's one of the reasons. And variably, sometimes mercury, sometimes not. And we have ongoing issues through adulthood. We want to prevent the 20-year-olds from getting worse again after they had some recovery. You have to maintain a clean life, okay? And I worked with Dr. Dearborn. Dr. Dearborn is the one in Cleveland who discovered the Stachybotrys mold issue with the babies. And really the first doctor to talk about that. He's short and small and very energetic. And he was always excited about everything he was excited about. Nicest guy in the world. And he was excited about, he thought he was starting to prevent some babies from dying with bleeding in the lungs from mold that he found in the homes of areas in Cleveland and indigent areas where there was moldy, wet basements. And he went to the CDC and they said, "You're crazy." And eventually he convinced them because he showed them clearly what the story was, okay? I used to be a pathology doctor and I would get specimens from him, not from those cases because he discovered those a couple years later. But he's a very smart man and he discovered the mold issue. It's a real thing for a lot of our families and for the children, okay? So food, water, and air needs to be clean. And if you think mold is there, it probably is. If you smell it there, it probably is. Get these filters for your house while you're taking care of the problem. Okay, remediation is a big headache, but it's worth doing. Okay, and some of the kids do fine and they go to school and they flip out. And there are cleaning agents and carpet residues. All you have to do is look at Doris Rapp with 2 Ps. Doris Rapp, and go look on the internet at the film she shows of the mouse crawling across the kindergarten floor that has new carpet, and the mouse doesn't get across the floor. Becomes paralyzed. Neurotoxins, okay? And are the kids sitting on the floor in the kindergarten? Yes. That's why I say steam the carpet, the brand new carpet. No, nothing but just hot water. Steam it and clean it. Okay. All right, medical care of people. Well, if we think that autism and spectrum-related issues are medical, then we treat them medically, all right? And if you go to that middle bullet, we do tests and treatments and things like that. You go to the middle bullet, we need to work with parents. You would never tell, sometimes the diabetic person is told, well, we have this insulin that lasts all day, but it doesn't give you minute-to-minute control, or you can give yourself little shots of insulin or get an insulin pump. I want to do the one that's, because I can't do that thing all day. I need one that's going to stay with me. I do one shot because I work different shifts and I got all these kids, or he's a teenager and he's not going to listen to me. And all right, let's try it. There's got to be something you can implement, okay? And we work with the parents, and they need to be able to say they can do it. And it's not a judgment if they say, I'd rather do this technique than that one, okay? It means they have to be able to implement what it is that I or someone else recommends. And sometimes there are many practitioners on the case. Instead of yelling and screaming and fighting and putting parents in the middle, because some of the treatments that I talk about are controversial in other minds of other doctors, and I think it's controversial to give the same dose of vaccine that you do to Shaquille O'Neal to somebody who weighs less than 340 pounds, okay? And so doctors shouldn't scream at each other. You tell that doctor I said that, that's just very difficult for parents, to be, or for a patient to be in the middle of. So I'm happy to get on the phone as much as I have to swallow my pride, and I keep looking up to see if, murder is legalized in some state somewhere, of another doctor and things like that. And sometimes you need to do what my friend Teresa Wrangham said in much more diplomatic terms than I did. One of the parents asked, I have this doctor who threatens me and yells and says this is crazy and I'm a bad parent, and I want to just, all I did was ask about the safety of vaccines. And I went on and talked about all kinds of things, and she leaned to the microphone and said, change doctors. So you always have the right. I think there's too many doctors in the United States, and there are not enough good ones. But you do have the right to do that. And sometimes parents and adults and persons on the spectrum get very intimidated by physicians and practitioners and nurses. And we're there to help people. The patient always comes first. What about the testing? Well, there's a lot of them. You can go to the Great Plains booth and see a lot of these tests. But a lot of them are basic CMP, CBC, these things you can get at conventional hospital lab tests. And they blend with things like we do from Great Plains. But we do test blood metal tests that they will not do at conventional hospitals. And we look at nutritional things like amino acids. And these are conventional tests. They're out there. And some of the labs say, I never heard of that. Well, that's nice. It's in your computer. Look it up. And our parents have my cell phone. They call me. And sometimes I get calls from the labs. And I got a call from Chicago the other day about what type of thyroid test. And we just said, would you find this in your computer? And they did. So they did. What about imaging? Dr. Michael Usler is the world's expert in brain imaging, I think, in my view, for developmentally disabled children and adults. He's got to talk when they do x-rays, okay? And what does that do? The bottom line there, it helps the doctor know what to do and to follow, the course of treatment. So sometimes we have 2 or 3 options, and we might want to only pick one, and sometimes the test helps to be the tipping point, okay? What about psychiatric psychoactive drugs? I'm not against them. Many of our kids are on special diets and cannot take the commercial ones that have the starches and the grains and stuff, and some of them have metals in them, toxic metals. Would you believe it? Aluminum's the biggie, okay? And so, and it doesn't mean you have to choose between risperidol and methyl B12 shots. It means they can usually be used together. And there are side effects to everything, including supplements and so on, usually mild. And there are side effects to these drugs. Some of them are just the kid just is very zombied, and they don't bite themselves anymore, but they won't learn or read or interact with the family. And most parents want some happy medium. Okay, and I think any good doctor, and even psychiatrists that like to prescribe these, we have Dr. Ban is here with us from Korea. Gun, are you in the room? Is he in the room? Dr. Ban is all the way from Korea. He is one of the world's experts in psychiatric drugs for children and adults and teenagers. He's, kind of an unassuming guy with salt and pepper hair and glasses, and he looks Korean looking. And he is somebody you can talk to about the research he's done over the years. These drugs can do a lot of good, but we need to kind of use them sensibly. And I think it's safe to say he agrees with that. Dietary interventions, my wife's going to speak about that. There are other speakers here who are going to talk about it. And she's coming tomorrow and speaking on Sunday morning, Joyce Miller DeMio. And so bottom line is there are lots of diets, and I'm not trying to do a whole discourse of this. But they look at these issues, and anything you do, you should have goals. And I don't just ask people to do a diet. Diets are always the hardest thing to do. It's easier to do a B12 shot most of the time, easier to spend even 2 hours in a hyperbaric chamber, and there is one here. And that's, about 2 hours is a long time, but it's not all day. It's not at the wedding, with the food that's there. It's not during Halloween. It's not every night and every day and every meal and every snack. And the diets are a challenge because it's a lot to do, and the parents want to feed the kid and the grandparents want to do things. But it's worth it when it works. And it doesn't work for every kid, but most of the kids will have some response with their Asperger-type frets and their quirky behaviors that are interrupting life and things, or cognitive dysfunction will go forward, and their immune system and their GI tracts are healthier when they're on proper diets. It just doesn't make sense to me that any doctor, whether they're a psychiatrist, GI doctor, whatever, that sees children with autism would not talk to people about the diets and tell the parents and ask what they're eating. Many of our parents have gone to a gastroenterologist, and there are many fine ones out there, and they don't ask them about anything they're eating. The parents have to bring it up. So diets are helpful, if not simply to be a part of good health. So at the bottom, there are many different diets: gluten-free, casein-free, corn-free, soy-free, yeast-free, okay? Sugar and carbohydrate restrictions. There are all kinds of things. Phenols, if you've heard about these, LOs, the low oxalate, and some infrequently used ones, carotenes, all these antioxidants that we hear are good for our diets that sometimes are a problem for our kids, okay? And one of them that seems complicated, but it really isn't. Dr. Burstein was in the room. He's gone now. He left. You can look up Dr. J. David Burstein, Burstein, on the internet and see his picture, and he's here, and then you can go up to him and ask him. He's one of the nation's experts in interstitial cystitis and urinary issues. He's a urologist, and we were talking last night about oxalates, and I talked about a case. He said, what's the kid doing with calcium? Well, the kid has pain in their genital areas, and then he asked about calcium. Because oxalates are like tiny kidney stones and little grains of glass, and they make you hurt all over, and they make you hurt when you're urinating. And yeast, zero in on that second bullet down, yeast is a big cause. And very few foods are an issue with that, okay? Very few foods are an issue with that. And so some of them are chocolate and things like that. These brown-colored liquids, cola, chocolate, okay? Kids just hurt all over, and they look like they have a urinary infection, but a lot of times it's a yeast issue. Okay, here's an example. The parents gave me permission. This kid also clearly, and he has more hair now. He has testosterone issues too, and big pupils. But that white stuff in the bottom of the urine is oxalates, and when it's spread out with air and liquid to it to your right, and again with the mother's permission, it has colors, white and red. It's not blood red. It's like a cranberry red, and it's powdered. I mean, then what urine dries like that? He's not got baby powder on or anything. That's oxalate. Those are those painful crystals. Okay, gluten-free has all kinds of reasons why you would use it, but the bottom line is that we want the endorphins to work better. We want allergies reduced, and if you know about the excitotoxic issue of too much glutamates and aspartates in the brain, those are things that can get help. And the bottom line is, again, the pragmatics of this. Joyce DeMio is going to talk about on Sunday at her talk. She has all kinds of food that she'll show you that are, you can, because the pragmatics are, the work is in the implementation, figuring out what foods to do. But some kids just can't get by unless they're totally 100% to the molecule gluten-free. Enzymes can help in some cases. You can talk to Dr. Devin Houston, one of the world's experts on that. Some kids get worse with the diet very rarely, or they get worse with enzymes. It's a little bit tricky. And the diets are a shift. And some kids will get worse for 2-3 weeks, and then they come out of it with some mental clarity. It's usually not that long. Usually it's 3 or 4 days into it. Okay? But it's hard to cut out dairy and wheat, but you eat other starches, potatoes, bananas, nuts, seeds. A lot of those, when they're processed, are contaminated with gluten. Okay? Sugars, let's look at this next thing. And I don't mean a fresh piece of fruit. I mean table sugar that's crystalline, okay? Beet sugar, cane juice, evaporated cane juice, sucanate, all these flowery names. It's cane sugar, okay? That's hard to digest, and it lets yeast and other things grow, and that's a problem for a lot of the kids. And then there are carbohydrate restrictive diets for ease of digestion. So some of the more dense starches are off limits on that diet. This is the specific carb diet, okay? Some kids will not eat because they're such carb addicts, okay? So you have to ease in, and that's where enzymes really help with those low-carb diets. Helps you digest. The carbs, we really can have a lot of headway. Ask Dr. Houston about those at the booth there. Phenols and salicylates, these are synthetic and natural colors in foods. Some kids can't tolerate blueberries because the color is too much for them to destroy in their body, and they get reactions that are almost like a miniature aspirin overdose, and their behavior is worse. You can look up Sarah's Diet with an H, Sarah's Diet, on the internet. It's not free anymore, I don't think, but if you look it up, you can find things about it. And that reversed the autism and some of the seizures in this young lady, Sarah, who ended up not surviving because of her seizures. It's a sad story, but she had a wonderful 20 years or so of just recovery because of, and it is a sad story at the end, but her father really, really made headway. Nobody believed him when he said you should cut out sweet potatoes and tomatoes and carrots in this young lady, and it was the one thing that worked. Yeast diets, my son is on this one, so you get bread that's made without yeast. You eat foods that don't allow yeast to grow, and it can be tricky, but you usually start with some carbohydrate restrictions and so on. What about allergy mediation here? A lot of kids are sickly all the time, and if you eliminate some things they're allergic to, it's not that complicated, but it's cumbersome. If you pull out a lot of the foods they eat and then rotate things, sometimes you'll get an issue where they'll get better. If they only eat 3 things, though, you can't do this diet. You can't pull out 3 of the 3 things they eat and then see how they're doing. So you have to work on other things, working on the leaky gut and some of these irritations that inflame and let the gut absorb toxic material by treating yeast, by doing methylators, and some of the metabolic support is improving, the kids, okay? Whole foods and organic food is hard because they're very perishable. That simply means a carrot is different than carrot cake. Right? It just means the whole food's not processed, less chance of contamination, less chance of gluten contamination at the factory, things like that. Okay? And some kids will not eat whole foods, and you've got to kind of ease them into it with enzymes and have variety of foods. And some kids are very, very tricky, and we've got to help their cognition so their willingness gets better and their OCD gets better, so then they'll broaden a little bit. And sometimes you can't do these diets right up front. You've got to give it a little time. Fermented foods means things like live sauerkraut and yogurts and kefirs and things of that nature. And there are many nutritional supplements. The biggies are in the bottom there. Sometimes probiotics and zinc and a methylator like a B12 shot or TMG will really make headway. And anything can cause side effects. Some kids get very stimulated when we do these. And sometimes we use drugs for yeast And for all these different germs, some of the take-homes on this slide is there are 4 different strep germs in this kid's intestinal tract. This is a stool test. To your right are parasites, and at the bottom there's yeast seen not on the culture but under the microscope. This kid has everything. This is an immune system problem, okay? And so we sometimes use antiparasitics and so on, but it's not a hygienic issue like you weren't clean. We're all exposed to these things, okay? But it's just that their immune systems let them survive, and we need to help the immune system. Chelation we talked about. This is what we discovered in one of the vitamin companies, nobody here, who was being contaminated by antimony from another country in the supplement flavoring. And in the bottom, the kid's much cleaner and did much better. Curcumin, some drugs that are designed for metabolism help the white cells metabolize. Naltrexone, these are things we use for the immune system. Hyperbaric, you've got the chamber out there. It's an immune system and a GI treatment. And far infrared's also another treatment. And just a word about Lyme disease. Just like I said with mercury on this last closing moment, Lyme disease is a real thing. I'm a member of the International Lyme Associated Diseases Society. And many of our kids with spectrum issues, and many of the parents have Lyme. Not everybody does. There are groups that tell you every case of autism is really Lyme, and that every kid who gets Lyme is going to get autism if they get it before 2. It's not true. But many of the kids get better, and they don't always have to have a bullseye rash. So it's worth considering. Sometimes it's actually congenital, and not trying to blame parents here. It's just a reality that doctors should be able to talk to people about. Again, another controversial issue. So that young lady there is one of our patients who never used to sit still, and with the treatments, she's not cured, but she's much better and much happier. So that's the goal: make the kids feel better, make them happy, and improve their symptoms that they don't want to have. So thank you for your time and attention.